Ticks are bloodsuckers that with a successful bite can cause catastrophic illnesses in people and animals. According to the CDC, Minnesota is the fifth worst state for tick-borne diseases after Pennsylvania, New York, New Jersey, our neighbor Wisconsin. And experts say we are going to have more ticks this year after our gentle winter.
Now, this is Talking Points on CBS News Minnesota.
Good evening and welcome to Talking Points, where we are tackling perhaps the least loved animal in our upper Midwest animal kingdom. We will be going in depth about what ticks can do to you and your pets. And in the pet world, it's not just dogs. We will tell you about the potentially fatal tick-borne illness that is increasingly being diagnosed in cats. You'll also hear from a doctor about the surprising facts about how long it can take after a tick bite for you to actually get very sick. You'll hear from Dr. Jennifer Granick of the University of Minnesota Veterinary School, as well as Dr. Maggie Kappelman, an internist and pediatrician with mHealth Fairview. But first, let's start with a woman who has spent her entire career studying ticks, Janet Jarnefeld. Joining us right now is Dr. Janet Jarnefeld, who is a tick vector specialist with the Metropolitan Mosquito Control District. Thank you so much for coming on.
You're very welcome.
All right, let me ask you, what does a tick vector specialist do?
Well, there's a lot involved. I keep track of what's happening with deer ticks in the metropolitan area in the 7 counties. I respond to any questions from people that call, or if they send ticks in, I will identify them for them and kind of keep track of what's occurring out there in the tick world if there are new ticks coming.
Got it. Are there more ticks this year?
The answer to that is really, I don't think so. The thing is that over the last 3 years, springs were more of a drought kind of scenario. So it was harder for ticks to survive and emerge.
All right. And do ticks serve any purpose in the natural world?
I get asked that question, and I can honestly say I'm not so sure that there really is so much of a purpose that I'm aware of, but there must be something.
Do they benefit any one particular animal? I mean, birds eat them, don't they?
Some birds and other things might eat a tick, but if you think about it, the hard ticks anyway, just think of it as an exoskeleton with a big, huge stomach in it. So I don't know how much nutrient you would get from a tick. Unless the tick had fed, maybe you would get some nutrients from blood. But
Is our area more prone to having ticks than other areas of the country?
I wouldn't necessarily say that. It just kind of depends on, for example, if you're talking about it in the desert parts of the U.S., you're probably not going to be dealing with a lot of ticks. Different tick species also occupy different regions of our country. So, and different tick species have different levels of their population. So it gets complicated to explain the whole thing.
Okay. In terms of diseases, which ticks do you really focus on in terms of the ticks that are available or that are here in our area?
In Minnesota here, it's primarily the deer tick, Ixodes scapularis. That's the big, heavy disease vector. Our second most prevalent tick species would be the wood tick that will bite people. And they can transmit diseases in other parts of the country, but they're not so prone to transmitting them here. So we consider them more of a pest in Minnesota.
What do you think is the most important thing to watch out for?
I think because we're talking deer ticks in Minnesota are the biggest threat of people contracting a tick-borne illness, you always want to be aware if you're in the deer tick habitat of woods or brush. Wood ticks are going to survive more in tall grass. That's their main habitat. After you've come back inside from being outdoors, it's always a good idea, like when I go out in the field and I come back in, I will take a shower, and it gives me an opportunity to check for ticks. And then I can also change my clothing. So if there were ticks harboring on my clothing, I can change the clothing and the ticks won't have an opportunity to attach.
Yeah. And what is it about dogs that ticks seem to gravitate towards?
I think I think their fur is probably easier for them to grasp onto than our smooth skin that we have. What a tick will do is sit up about a foot and a half high on vegetation, and when they smell us or a dog or something come around, they wave their front two legs around, and their tarsi have little claws on the end that grasp onto you or your dog. And I think it's dogs are more prone to be moving around a lot more in the habitat where the ticks are, and they're just easier to grab onto.
Okay. In terms of tick containment, we were talking about that earlier. Um, would it be possible to contain ticks the way we try and contain mosquitoes here?
Mosquitoes are a lot, there's a lot that's different. When you think of a mosquito, everything is quick, and we know where their eggs are laid. They're laying in water. When you think about a tick, they're slow. They have a very slow life cycle. They're not all laying their eggs in the same location. It's spread out. Um,
Got it. All right. Well, listen, thank you so much. I really appreciate your insights. Up next, what you don't know about how ticks can harm your pets, including those cats. Well, joining us right now, Dr. Jennifer Granick. She is an associate professor at the University of Minnesota Veterinary School. She is also a doctor of veterinary medicine. Dr. Granick, thank you so much for joining us.
Yeah, thanks for having me.
We want to talk about pets and ticks. What should we watch for, and how serious can a tick bite be on a pet?
That's a really good question. And the clinical signs, so what the pet would show you if they were sick from a tick-borne disease, could be really varied depending on the particular infection and the severity of it. But often it could be anything as vague as just not seeming themselves, being a bit tired or lethargic, to and not eating. That's often an indicator. I have Labrador retrievers, so if they're not eating, I know something's really wrong. And we can even see signs like they're uncomfortable walking, or a reluctance to get up. So that's an indication of pain in the joints, which is pretty typical of most of the tick-borne diseases that we see in Minnesota. What would be great is to watch for, before they get sick, is just the presence of ticks. So if you're out and about with your dog, or even in some areas of the Twin Cities, yeah, there are deer that can be in neighborhoods, and they're carrying deer ticks. And so even if a dog's just out in the backyard and you have a lot of scrub or long grass on the edges of the yard, that would be a reason to check them before they're coming in.
And I don't want to ignore the cat population. Do cats get ticks too?
Yeah, so cats that go outside definitely are at risk for ticks. They don't get the same diseases typically that we see in dogs, but one that you may have heard of that we're seeing kind of more frequently in Minnesota than we used to is a disease called tularemia. And cats can get really quite sick with that. They get high fevers. They're extremely lethargic. And if not recognized and attended to pretty quickly, it can be a fatal disease in cats. So if your cats go outside, ideally protect them by using flea and tick prevention.
Okay. And that's more, any idea why it's on the rise here?
I could theorize. I don't really know. One thing for sure is that I think veterinarians are recognizing the disease more than we used to. So there's increased awareness. So that's definitely part of it. It may be, changes in climate as well, changes in sort of wildlife domestic animal interface. So more opportunities for pets to be out and close to wildlife that can be carrying those ticks or carrying those diseases.
What do you do as prevention? Because I've heard a number of different things in terms of what you should ask your vet for, or what your vet should prescribe. What do you think like an average dog should get if he or she is out in the woods and or walking around, outside a lot in Minnesota?
Yeah, so this maybe changes a little bit depending on exactly where you are in Minnesota. Anywhere in Minnesota, there can be ticks. And so what we call flea and tick preventatives, those can be things like flea tick collars, topical sort of spot on preventatives, as well as even oral preventatives now for flea and tick prevention. You said, what should your vet recommend or what should you get from your vet? And that's really the key, is the discussion with the veterinarian, because you want to make sure that you have a flea and tick preventative that's appropriate for your dog and your particular situation. And that can include if you have kids or other pets in the house like cats. There are some flea and tick preventatives that are toxic to cats. And so you want to make sure that if you are getting a flea and tick preventative for your dog, that's something that's cat safe, or at
Wow.
least that you are following vet recommendations in
Is
terms of
that a
how long.
topical one?
That
The
can,
one?
yeah, topical one. So
Oh,
uh,
wow. Okay.
yeah, permethrin is the in the ingredient that would be problematic for cats, and that's found in a lot of just over-the-counter flea and tick preventatives. So
Wow.
yeah, and you may, I think those should have warnings on them, but you may not, see that. So always consulting with your veterinarian, I think, is the best
Okay.
option in terms
And
of
what's the
picking.
ingredient to watch for there?
It's permethrin.
Okay. And what can it do to cats? I mean,
It can be lethal, yeah, if they
okay.
ingest it, yeah.
All
So
right. The oral medications you can give to dogs, explain that because I find that a little bit confusing.
yeah, well, the topical flea and tick preventatives basically get into the skin, and so the oral ones, it's basically system. They take it in, and then it gets into the skin that way. So basically, what these things do is that when a flea or tick bites, they ingest that medication, and then that kills them.
How
So
long is the oral medication good for, though?
So it depends on the particular oral medication, but most of them are between 1 and 3 months that you need to repeat dosing.
Okay, so that would be a good way to go if you're going to be up north a whole
Yeah,
bunch or camping
yeah.
in the summer weeks. What How do you, I know a lot of people, well, I know a number of people who've had dogs with tick-borne illnesses and they haven't figured it out until later, which I think is pretty easy to not figure it out because it
Yeah.
mimics so many other things. What are some of the dangers of letting it go that long?
Yeah, that's a really good question. The one that I get the most concerned about is Lyme disease. And that one in dogs, it's really different in dogs than it is in humans. We know humans get Lyme disease in Minnesota as well. But dogs don't show signs of illness sometimes for 2 to even 5 months after
Wow.
yeah, so it can be really delayed after you see a tick. So you might not be out of the woods quite yet if you pull a tick off, if it's been on there for more than a couple of days. The good news with Lyme is if you see a tick and you're checking daily, it takes a while to transmit the infection. So you can sort of stop it before it starts. Lyme disease is particularly concerning because most dogs that get Lyme disease, they have a fever and achy joints, and giving them antibiotics will clear that up in a few days. But there's also another manifestation of Lyme disease, and that affects their kidneys, and they might not show any signs of that until it's really far progressed. So if you notice ticks on your dog, or you're in an area where ticks are common, then routine visits to the veterinarian, well, they can check with a really easy test to see if there's been any exposure to Lyme, and then they can do additional tests like checking the urine to make sure that there hasn't been any damage to the kidneys. And if there has, they if they do see those changes, then they can intervene early and try to treat early, which means that those dogs are going to, have a better prognosis than if we catch it by the time they're already showing signs of the kidney manifestation of Lyme disease. Then it's really hard to do anything about it at that point.
Well, I'm gonna have to cut you off because we're running out of time. Dr. Granick, thank you so much. This has been really informative. As a dog owner, I really appreciate it. Up next, a closer look at what a tick bite can do to humans. Well, joining us right now, Dr. Maggie Kappelman, who is both a pediatrician and an internal medicine specialist. Thank you so much for coming on.
Of course, my pleasure.
Let's talk ticks here. How do ticks manifest their bites differently in adults and children, or is it just the same?
It's essentially the same. I think the diseases that can affect adults are also diseases that can affect kids. And like many things, sometimes kids can have more severe reactions to diseases. And so it's especially important to be cognizant of tick-borne illnesses and be careful when we're out playing and at risk of getting tick bites.
In terms of getting tick bites, I think a lot of parents don't like the DEET formulas because of how heavy they are. Is that really the only thing that is good out there?
It is actually what I still recommend. So I still do recommend DEET as the primary prevention strategy for avoiding tick bites, especially when you're going to be in areas that are especially tick heavy. So if you're going to be hiking or camping, DEET is still the mainstay to reduce the risk of tick bites. It does not take the place of good, thorough tick checks. And so at the end of every single day, it's still important to look at the entire body to look for tick bites. And the other things that can help prevent a tick from sticking on the skin are still important too. So like tucking your pants into long socks, wearing bright colored clothing so it's a little bit easier to see the ticks, especially this time of year when the ticks are smaller and they're still in their nymph form. Those are still helpful strategies, but DEET is still the mainstay. That's still the one I use and the one I still recommend.
You know, we all are hearing these nightmare stories of people who've had Lyme disease, and it's a prolonged case. It's often misdiagnosed, goes for months, but it profoundly changes people's lives. How does that happen? How do you get that sick from it?
Yeah, that's a great question. The concept of chronic Lyme disease is still a little controversial in the medical world. However, Lyme disease does have some chronic manifestations, untreated Lyme disease. And the way that works is because Lyme disease is caused by a unique type of bacteria called Borrelia burgdorferi, and that bacteria has different stages. And so early on, that's when we see really just the rash manifestation of Lyme disease called erythema migrans. That is actually pretty easily treated with a short course of antibiotics. And that's why it's important to know whether or not you've had a tick bite. Lyme disease, if it's not treated in that stage, then it can go on to affect other organs. And so that's why we as doctors, we try to talk about ticks, preventing tick bites, and then treating early. And then if somebody is having other symptoms, it's a good idea, since we live in a Lyme endemic area, that we test for Lyme disease and treat it.
What is this second phase? How does that manifest itself in both kids and adults?
So it can manifest as more of a systemic illness, fevers, joint aches, those kind of symptoms. Sometimes a rash.
Because that's lumped in with an awful lot of other things these days. But how long before that phase develops?
So that can be weeks after a tick bite and after that erythema migrans.
Okay. And that do antibiotics take care of that as well, both in kids and adults?
They do, yes. And so it can be a longer course of antibiotics, depending on what organ system is affected. But it's never wrong to ask, could this be Lyme disease? Because especially this time of year, these things could be Lyme disease or could be another tick-borne illness.
Is it still misdiagnosed even here where it's so prevalent?
It is, unfortunately. And part of that is exactly like you said, it can look like a lot of other illnesses.
Wow. And what usually is the problem? Just that people think it might be maybe even COVID or something like that?
Yeah, exactly. That it could be another virus. Many viruses are still around this time of year and can cause similar symptoms. And so having a high index of suspicion is key, looking for tick-borne illnesses.
You mentioned that it goes after the organs in this second phase. Are there any organs in specific?
Yeah, there are some, and that's actually the third phase. So there are joint manifestations, so Lyme arthritis. There's something called Lyme meningitis, where it affects the lining around the spinal cord. There's Lyme carditis, where it affects some of the heart tissue. And these, yes, sound very scary. In some ways, when that happens, the symptoms are a little more obvious. And so the diagnosis can be arrived at a little bit quicker. And fortunately, antibiotics are still very effective at treating these problems. They just need to be diagnosed correctly. And those manifestations can happen actually months after the original tick bite.
And how about later on? Is it, you know, if it goes even to a further stage, do antibiotics always work even when it's been an infection for a long time?
They do. Sometimes that needs to be longer term antibiotics. And I mean like several weeks of antibiotics, not months. And sometimes they need to be given through an IV instead of a pill form.
Okay. And are ticks sort of adapting and changing in terms of the way they're, you know, affecting people and the way the disease is affecting people?
In terms of Lyme disease, it doesn't seem like it, at least not to my knowledge. It's more that global warming is making it so that tick endemic areas are wider than they used to be. And so there are some seasons that are worse than others where there are more ticks around, especially after a milder winter. And so that's why we're talking about it a lot more.
That would be this year.
That would be this year. And that's why a lot of pediatricians are talking about it and talking about being vigilant and watching for ticks. The Minnesota Department of Health has really great information on tick-borne illnesses on their website, so you can keep track of how many tick-borne illnesses are being reported in the state.
Thank you so much. We really appreciate your insights.
Of course. Thank you for having me.
And that does it for this edition of Talking Points. As always, you can email me with comments and suggestions at esme@cbs.com. The show streams every Wednesday and Thursday night at 6:30 and 9:30 p.m. on CBS News Minnesota. On Friday, the show posts to YouTube for on-demand viewing. Thanks so much for watching. I'm Esme Murphy, WCCO News.